Уважаемые коллеги,
Dear colleagues,
заболевания, связанные с расстройством роста и развития
height disorders and skeletal maldevelopments, including achondroplasia, that reflects on appearance are well known long ago. From point of view of modern medicine, achondroplasia is congenital genetically conditioned disease. The main symptom of this disease is height delay, and at the end of natural growth, the difference is 35–40 centimeters. Expressed disproportions between body length and upper limbs is not only cosmetic disadvantage, but it also decreases functional abilities of the patient. At work, self-service driving causes compensative motions at shoulder girdle and trunk, which leads to secondary spine deformities. Lower limbs proportions restoration leads to patients' height increase for 20–30 centimeters, which increases disproportion between body length and upper limbs even more. It decreases the possibility for self-service and the possibility to increase the height of upper limbs. At the final stage of treatment, we perform humerus lengthening for anatomically and biomechanically based amounts. Our investigations proved that upper limb shortening is mostly due to proximal segment shortening. Expressed muscles significantly distort the anthropometric measurements, which complicates the definition of anatomical landmarks of bone. As a result of relative muscle excess, together with hand-height delay, arm looks shorter than other segments. Elbow joint contracture at some patients can be 110 degrees, puts serious distortion at projective bones length. That is why true correlation of proportions of segments of upper limbs in achondroplastic patients better to determine by lateral view of X-ray. To restore correct biomechanical chain of upper limb, we should perform proximal osteotomy above tuberosity deltoides and distal one at supracondylar area. At the length of distal regenerate should be 30% from total amount of lengthening. It allows to restore biomechanical proportions between muscles length and humerus. The process of humerus lengthening is accompanied by changing of segment volume. In case of average amount of lengthening 67%, its volume increases for 60%, and correlation between shoulder volume to its length comprised 16 cubic centimeters at 1 centimeter of humerus length, which is 96% from initial level. It confirms that all tissues of shoulder are actively growing, not only stretching. There were no signs of skin stretching at lower third of shoulder. According to X-ray with dye and sonography, after lengthening, muscles shape, length, direction and structure of muscle fiber and intramuscular septa have structure similar to normal. Radiologic criteria for regenerate maturity by the time of frame removal was uniformity of structure, formed cortex layer as linear structure of bone density. Ultrasound criteria of regenerate maturity is formed cortex layer as uniformity linear, hypoechogenic signal, and echonegative In long-term follow-up after frame removal,
Структура кости приобретает нормальный вид.
Bone structure obtains normal view and uniformity of medulla canal is fully restored.
Одним из признаков визуализации данных и биомоделирования
The example for that is 3D relief
является получение трехмерного
of
рельефа
optical image of X-rays.
оптического изображения рентгенограмм. Оптический рельеф на данном этапе
X-rays processing algorithm
демонстрирует явное
demonstrates obvious decrease of optical density of regenerate if to compare with the maternity bone.
Алгоритм обработки рентгенограмм заключается
X-ray processing algorithm is that the resulting image embossed surface height
высота и цвет каждой
and color of each point
является функцией яркости
is a function of brightness, that is density of the original image at this point.
Приводим клинический пример.
Clinical example.
13 лет диагноз ахондропрозии
13-year-old patient diagnosed with achondroplasia, low height, tibial lengthening for 14
на
centimeters.
заключительном этапе
At the final stage of treatment,
проведена операция двойная
we performed double corticotomy of both humeri, Ilizarov fixation,
дистракция 77
77 days of distraction and 82 days of fixation.
на 10 сантиметров
10 centimeters achieved lengthening.
контрактуры локтевых суставов
Flexion contracture of elbow joints were eliminated. Treatment result was good.
на слайде представлены осложнения, отмеченные при удлинении плеч устава
Complications after lengthening 808 patients and 216 segments.
Наиболее частым осложнением в процессе лечения
Most common
остается
complication
воспаление
is
мягких тканей вокруг
pin track infection,
которая составляла 12%
which comprised
от
12%
количества
from
сегментов.
total amount of lengthened segments.
При этом только в двух случаях неэффективность консервативного лечения
Only in case of not effective conservative treatment,
послужила причиной для удаления
we had to pull out the wire.
во время периода дистракции. Основной причиной
Main
этого
reason for this
является
complication
прорезывание
is that wires cut in soft tissues during distraction.
Полученной нейропатии 18
Neuropathy, 18 cases developed in early post-operative treatment,
послеоперационном периоде и, вероятно, являлись
and it was
следствием
caused by nerve trunk contusion at complete fracture of cortex.
клинические нарушения проявлялись
Clinically, apparent violations in the form of radiating along the nerve damage pain arising from the movement of the elbow, sensory disturbances at the back of the forearm and hand,
ослабление или выпадение функций активного сгибания кисти и пальцев
decrease of absence or active
с
function
отведением первого
of hand and fingers extension with thumb abduction accompanied with couple gripper force was observed in 2% of cases.
Учитывая уровень поражения
Considering the level of damage, lower third of segment, we decreased distraction rate for all patients up to 0.5–0.75 millimeters per day.
одновременно проводили консервативное лечение.
Conservative treatment was conducted as well.
Несмотря на продолжающееся удлинение, наблюдался
In spite of the fact that lengthening was carried on, there was regress of neurologic symptoms,
сопровождаемый нечеткими
accompanied with bioelectrical activity of muscles, which proved efficiency of chosen tactic.
Таким образом,
So,
возникшее
this complication
в период дистракции подобное неврогенное осложнение
is not a
клинических признаков функционально-анатомической непрерывности
So this complication is not a contraindication
дальнейшего удлинения
for further distraction of the limb.
У всех больных было достигнуто запланированное удлинение.
All patients achieved humerus length as it was planned initially, hand function restoration by the end of fixation or during 1 to 2 months after discharge from the hospital.
Отсутствие диастаза между костными фрагментами
Absence of diastasis between the bone fragments at osteotomy site after distraction means incomplete osteotomy.
общее количество подобных ошибок 4%.
Total amount of such mistakes 4% from amount of lengthened segments.
7 из которых возникли на дистальной
7 of them were a distal fragment.
В 3 случаях удлинение произведено полностью.
In 3 cases out of 8, lengthening was performed at proximal level.
Еще в 3 случаях
In 3 cases, 5–7 days after distraction, was acute rupture of bone fragments under distractional forces.
Угловые деформации фрагментов процесса вгнения плеча
6.3% of cases with angular deformities were as a result of unstable osteogenesis.
Причины возникновения нестабильности могут быть
Reasons of instability can be
ослабление натяжения или перелом спицы,
wire breakage or loosening of the
удаление
wires,
спицы или воспаление мягких
tension
тканей.
decrease, wire removal in case of pin track
При
infection.
билокальном остеосинтезе в большинстве случаев деформации
In
возникают на
bifocal
уровне
osteosynthesis, in most of the cases, deformities occur at the level of proximal osteotomy varus or varus anticavatum.
вероятность появления деформации при монолокальном остеосинтезе
The possibility of deformities is higher in case of monofocal osteosynthesis.
на наш взгляд повышенная вероятность
We believe
возникновения
that the reason is longer bone fragments which increase
наличием более длинных костных фрагментов,
force applications levers,
увеличивающие рычаги приложенных сил, что предъявляет более
and it demands stronger fixation to the stability of osteosynthesis.
деформации после снятия
Deformities after frame removal were observed in 5 cases
соблюдения рекомендаций в период
and were as a result of not following the doctor's recommendation.
наступил перелом плеча на
One patient had humerus fracture at regenerate site because he fell at arm
месяцев после
6 months after lengthening.
повторный остеосинтез аппаратом Елизарова
Repeated osteosynthesis was done for 2 patients with deformities.
как видно из таблицы,
As you can see from the table, presence of complications increases treatment duration in monofocal and less in bifocal destruction osteosynthesis.
только у 8 больных
In 8 patients,
остеосинтеза осложнений
presence of complications did not affect duration of
при
treatment.
этом лишь в одном случае после снятия аппарата осталось
Difference in hand length was observed in 1 case.
в остальных случаях
In all other cases, deformities obtained during treatment were not eliminated completely and they did not affect function.
во всех остальных
In
случаях
other cases, complications were diagnosed in
в
time
конечном итоге
and they did not influence on treatment result,
сроки остеосинтеза.
although treatment duration increased for these 8 patients.
Таким образом, оптимальное лечение
Елизаров method
лечение репаративного остеогенеза
provides all necessary conditions for complications prevention,
при удлинении конечности предупреждает осложнение, возможно при расцветании комплекса условий, совокупность которых обеспечивает
and
метод Елизарова.
they provide complications prevention.
Стабильный остеосинтез,
Stable osteosynthesis,
малая травматичность оперативного
low trauma at surgical interference, full blood supply,
оптимальный темп
optimal destruction rate,
возможность функциональной нагрузки,
possibility of weight bearing on operated limb during treatment.
билокальный дистракционный
Bifocal destruction osteosynthesis shortened terms of osteosynthesis
количество случаев.
and number of complications in comparison with monofocal osteosynthesis.
Благодарю за внимание.
Thank you for your attention.
Thank you very much for your kind lecture and very impressive results. And time is now open for the discussion. We shall discuss to the first lecture of